Welcome to today's webinar. County Health Rankings and Roadmaps is a program of the University of Wisconsin Population Health Institute. This webinar is brought to you thanks to the contributions of colleagues and partners in Wisconsin and across the nation, with support from the Robert Wood Johnson Foundation. It is produced in collaboration with Healthy Places by Design, an organization that advances community-led action and proven strategies to ensure health and well-being for all. The University of Wisconsin-Madison occupies ancestral Ho-Chunk land, a place their nation has called Dejo since time immemorial. Today, UW-Madison respects the inherent sovereignty of the Ho-Chunk Nation, along with the 11 other First Nations of Wisconsin. This webinar will be recorded. All speakers' views are their own. Guest bios and slides from today's webinar are available on our resource page. We will share a link to the resource page when the webinar begins. Stay up to date on all things CHR&R. Find us on Facebook, X, and LinkedIn. And if you haven't already, sign up for our newsletter by scanning this QR code with your phone's camera. It's the best way to find out about upcoming webinars, our podcast, and our latest tools and resources. For your convenience, the QR code will also continue to be displayed for the remainder of this short video. We invite you to continue the conversation. Join our discussion group immediately after the webinar. Joanne Lee will be our lead facilitator. And watch for a chat from Soraya for details on how to join the group after the webinar.
Welcome, everybody. Welcome to Immigration Policy and Health, Building Understanding and Solidarity. My name is Soraya Willems-Neal, your host for today. The purpose of our webinars is to share successes and lessons learned and offer relevant resources, build collective knowledge, and listen for multiple perspectives. I want to note that the views shared by presenters, participants, and CHR&R colleagues, reflecting the expertise of more than 35 team members, are their own and do not represent the University of Wisconsin-Madison or the Robert Wood Johnson Foundation. I also want to acknowledge that funding support from the Robert Wood Johnson Foundation is appreciated. CHR&R webinars reflect the values we hold as part of the University of Wisconsin Population Health Institute. Values of collaboration, innovation, integrity, courage, inclusion, and excellence. And these are values we aim to model during the webinar, and we hope that you will too. With these values, now more than ever, CHR&R believes that everyone is worthy of dignity and that everyone should have a voice in deciding how systems function, and that we have the power to transform the future. We have data and evidence and language that provides context in our interactive text about relevant topics like power, rules, safety, and social support. And with that, I am pleased to introduce the team supporting our learning experience. And we'll begin with Joanne Lee from Healthy Places by Design. Hello, Joanne.
Hello, Soraya, and hello to everybody in our audience. We so appreciate you being here today. We want to invite you to join the conversation and engage with us during the webinar today. And there's two ways to engage. First, I'm going to point you to the Q&A box. You want to use that specifically to ask questions of panelists. So go ahead as questions arise, enter them in the Q&A box. I will be managing that box and triaging questions to present during the Q&A portion of the live webinar, and we'll get to as many questions as we can. There's another way that you can engage with other participants that's different from using the Q&A, and I'm going to introduce you to Erin to talk about the group chat. Erin?
Thanks, Joanne. Hi, everyone. Like Joanne said, I will be seeing you in the chat today. To participate fully, be sure to set your chat setting to everyone. As you can see, our chat gets very busy. We ask that you please adhere to our group agreements for a more productive interaction. And about the group agreements, you can see more information on our webinar resource page, which I'll share in a moment. I hope you all are staying healthy, safe, and warm wherever you are, and I'll see you in the chat. Now I'll turn it over to our technologist, James.
Hello, everybody. I'm James. I work with County Health Rankings and Roadmaps as a technology coordinator, and today I'm our webinar technologist. And I want to make sure that you have the best experience possible. So if you are having technical difficulties, reach out to me in the Q&A pod, and I can answer you there and make sure that things are working as well as possible. Soraya, we have some great panelists today. I'm really looking forward to this webinar, so I'll hand it right back to you.
Oh, thank you, James. Same. So, at County Health Rankings and Roadmaps model, the new county, and oh my gosh, the County Health Rankings and Roadmaps model of health emphasizes looking upstream to the policies, systems, and power structures, and not only individual behaviors. So, and that shape the community conditions and ultimately impact health outcomes. So, in honor of the National Day for Racial Healing, today we will have the timely discussion on immigration policy as a public health issue. Threats to immigrant and migrant well-being ultimately impact public health overall. We will elevate lived experiences and essential data, and we will also draw on narratives that reminds us that we are all connected across policies, contexts, and backgrounds, and that we depend on each other to create healthier communities for all. So I am so pleased, we are all pleased to be joined by Dr. Elizabeth Aranda, Director of the Immigrant Migrant Wellbeing Research Center at the University of South Florida, and Ivy Suriyopas, Vice President of Programs at Grantmakers Concerned with Immigrants and Refugees. And today they bring knowledge in immigrant health research, lived experience, and philanthropy to explore how immigration policy, legal uncertainty, and enforcement shape health and well-being and their implications for advancing health equity. Welcome, Elizabeth and Ivy. Good to have you here.
Thank you.
You. So I cannot wait to dive into our questions. You can learn more about Elizabeth and Ivy from their bios on our webinar resource page, which Erin will drop the link right now. So right after today's webinar, we will host a discussion group to unpack what we've just heard. So please plan to stay and continue the conversation with us. As mentioned in the video introduction, our post-webinar discussions are facilitated by Joanne Lee, and they are always engaging, offering a chance to share insights and learn from others. And Erin will drop the link in the chat at the end of the webinar, so you can join the discussion group. And then lastly, keep an eye out for this webinar's resource guide. It will include links to the materials shared by our guests and participants in the discussion group, and we will be sending it to your inbox before the end of the week. So I am eager to start the conversation with our first guest, Dr. Elizabeth Aranda. Hello, Elizabeth. Welcome.
Thank you so much for having me.
Yes. So let's begin by acknowledging immigration enforcement has intensified recently, creating an environment of uncertainty and fear for many immigrant communities. So with that in mind, could you start by briefly introducing your role at the Immigrant Wellbeing Research Center and share what you want the audience to understand how these legal uncertainties affect immigrant health?
Yeah, absolutely. Thank you. I'm the founding director of the Immigrant Wellbeing Research Center here at the University of South Florida, and I'm also a professor of sociology. And the Immigrant Wellbeing Research Center was founded in 2022, and its mission is to conduct high-impact research and translate it for the public at large, but also for the media and policymakers. And more recently, given everything that's gone on in the last year in the policy space, we have pivoted a bit to make sure that we're documenting the current realities that are facing immigrants. So because this is fundamentally driven by research,
What we seek to do is to document a record of what immigrant experiences are within this, evolving immigration context, because there are new executive orders every day, there are new policies and practices every day. And so that's really what we're trying to do, to document this so that future generations can look back and find empirical data on what's going on in today's day and age. We also host a podcast called Immigrant Lives, and that's meant to break down the academic jargon in journal articles so that people who work with immigrant and refugee populations can really understand, what the issues are that affect them. And so we invite scholars to be on the podcast, and we try to break down that jargon for the lay audience. In terms of the other part of your question, legal uncertainty can take various forms. It could be someone with an undocumented status, or someone in search for a regular status. There are temporary statuses like deferred action for childhood arrivals, which is known as DACA. And there's also temporary protected status, which is known as TPS. And oftentimes, immigrants might occupy one of those temporary statuses on their way to legalize their status. Now, the legal uncertainty, though, isn't just affecting undocumented and people with temporary status. It's also affecting people who are lawful permanent residents, or they have their green card, which means that they're one step from getting naturalized as a U.S. citizen. And also U.S. citizens who are related to immigrants, and increasingly U.S. citizens who are just allies of the immigrant population are being affected by legal uncertainty. For immigrants, though, these in-between and temporal statuses can affect their physical and mental health, not just because of the uncertainty, but because of the risk of detention and deportation. Studies throughout the years have shown that chronic stress that is produced by legal status fluctuations has physiological effects such as cortisol dysregulation, sleep disruption, anxiety, and long-term health risk. Now, in a recent study we conducted that included immigrants from representing all statuses, including their US-born adult children who are obviously citizens, we found that across the board, most, if not all, participants reported appetite loss, sleep disturbances, and some even reporting drastic weight loss, hair loss, high levels of distress and anxiety due to reports that legal status doesn't seem to matter when you look at Immigration and Customs Enforcement, or ICE, as we call it, arresting people in all sorts of places at their ICE check-ins or their court hearings. So there's also been a fear of racial profiling among these very populations, including citizens. And it feeds into the stress that people may be detained during traffic stops. And for immigrants, fear of deportation, but more than that, fear that they will be separated from their families for good. So, because of the policy volatility and the practices that seem to circumvent due process, as we've seen most notably in the last 2 to 3 weeks, we're seeing population level stress.
Yeah. So, what do you want the audience to understand about lived experiences as a source of public health data?
Well, I'll use the example of a study we conducted last year on the effects of Florida's Senate Bill 1718. This was a law that criminalized various aspects of immigrants' daily lives. We conducted a survey with a sample of 466 immigrants and U.S. citizen adult children of immigrants. We wanted to know the effects of this law for various aspects of their lives. We found patterns of distress across the population, as well as healthcare avoidance, among other patterns. And while this method is useful for identifying population patterns, it is limited in terms of understanding what these patterns look like at an experiential level. For our most recent study, we took a qualitative approach consisting of semi-structured, in-depth interviews with 53 participants. Each interview lasted between 1 and 3 hours. And here in this kind of study, we take the time to really listen carefully to participants' narratives, their stories, and how the patterns we identified show up in their everyday lives. The report we just issued has quotes from participants so that people can read immigrant narratives for themselves. And so once we have both forms of data in terms of quantitative and qualitative, we can then connect the stories from the qualitative to broader structural factors. And in that regard, challenge misperceptions about the immigrant population by disseminating immigrants' own testimonies.
Yeah, so you briefly described your research approach. Can you go a little bit deeper into that and what makes it, well suited to this topic?
Sure. So, our approach to research is to uncover immigrants' experiences and tell these stories using their own words. This is part of a broader approach to research that is what we call community engaged. So, in this kind of research, we partner with community-based organizations and bring our findings back to the community so they too can understand that what they are experiencing is also being felt by others in their communities. This kind of approach is crucial if researchers want participants to trust us with their testimonies. These organizations vouched for us in the example of the studies we've conducted, and this helped establish trust, which allowed for our participants to open up about what they were going through. This can be a huge challenge, especially in a state like Florida. Florida is sort of a testing ground for many immigration policies. We have the third largest immigrant population, the third largest state with the state with the third largest immigrant population. Sorry about that. And it typically is a bellwether for things to come. So, what you're seeing in Minnesota, even though we didn't see anything in terms of ICE enforcement getting up to the level of what we're seeing in Minnesota. But last summer, ICE enforcement was very heavy in Florida because the state has a third of the nationwide partnerships between law enforcement and ICE. And so what that means is that law enforcement is deputized to act as immigrant officials. So this is why Florida, in my view, is so important because what you see in Florida is likely to be taken nationwide. So I mention that because immigrants really in the state are having a hard time trusting mainstream institutions such as law enforcement, even hospital and doctor offices. And this goes back to that law that I mentioned, SB 1718, that was passed in 2023. And it required all hospitals that were recipients of Medicaid funds to ask about patients' legal status. So that law, combined with Florida officials' eager cooperation with federal enforcement efforts, what we call 287G agreements, basically has led to immigrants going into social isolation. And that's what we found in our summer study, where we conducted those 53 interviews. It's the kind of socialization that we haven't seen since the lockdown phase of the pandemic. People were not going out to avoid detention or deportation. And in this kind of restrictive environment, it was a tall order to ask immigrants to open up about their experiences to university researchers. So that emphasizes again the importance of community partnerships and building trust.
Yeah, so you mentioned COVID-19 and how people were locked down, but this is different.
Yeah.
So, what patterns are you seeing across different immigrant communities?
So let me preface by saying that this can really vary across the region of the country in which you find immigrant communities. And it also varies depending on whether policies at the state level are protective of immigrants. For example, they might have sanctuary policies, or if these localities mimic federal enforcement first efforts of the likes that you see in states like Texas and Florida, where you have a lot of these partnerships. The media has shown images of enforcement pushes in states led by Democrats and cities with Democrats as mayors that ICE has targeted for focused enforcement. In those cases, you see people not showing up for work, immigrant businesses closing, maybe temporarily, but at least until ICE leaves the city. You see parents keeping their children home from school. And in some cases, you have mayors of these cities opposing ICE's presence. You also see groups protesting ICE in their neighborhoods. And this contrasts a bit with states that lean more conservative, where you might have Republican leadership in place. These states have the highest rates of deputizing agencies to act as immigration enforcement. And so enforcement might be more diffused, but it doesn't mean it's not there. It is definitely there. It's just not easily captured on camera by onlookers or the media. But nonetheless, enforcement officials are very present on work sites, on the roads, and in immigrant communities. So, in this kind of scenario, which we studied, we found that some immigrants stopped going to work to avoid driving because driving can be seen as the beginning of what they call the traffic stop to deportation pipeline. You get pulled over maybe for a broken taillight, or nowadays for maybe looking Latino, which is sort of associated with undocumented immigrants. And that opens the door to then possibly being detained, taken to a detention center, and then possibly even deported after that. Given the economic hardships that's caused by missing work, the immigrants in our study, some of them sold their homes, some of them moved in with relatives to cut down expenses. And as I said before, fear of family separation led to drastic social isolation measures where people stopped going even to church. They would have their citizen relatives go grocery shopping for them. They stopped going to doctor's appointments and would use home remedies if they were sick. They avoided police at all costs, including if they were victimized or if possibly if they witnessed a crime, they would really have to think carefully about whether to come forward because that could jeopardize their own well-being and being able to be with their family. And all of these stresses were unavoidably passed along to their U.S. citizen children.
Yeah, so um, can you describe even more so, like how do these conditions really affect families, children, and the youth as a community as a whole? So now looking at it on a community level, but also how does the health of immigrants affect all of us?
Yeah, that's a great question. Our studies showed that given what parents were experiencing, their children, again, most of who are U.S. citizens, they internalize these fears. For instance, if parents were driving and the young children were in the car, we often heard that children would warn parents if they saw law enforcement on the road. Parents reported that their younger children were anxious, hypervigilant. Some lost their appetite. Others worried about classmates who were undocumented, and yet others couldn't focus in school. One woman told us about her daughter, her young daughter, who would ask every morning as she boarded the bus to go to school, Mom, will I see you when I come home? And then when the girl would come back on the bus and her mom would pick her up at the bus stop, the young girl would always express relief that, oh, mom, you're here. You haven't been taken by ICE. That's just staggering. Children also suffered from the social isolation of their parents. Families stopped going to restaurants, parks. They canceled annual vacations. Pretty much anything that involved driving or exposing yourself, they minimized having to do that. And then the older children were taking on adult roles in what we call mixed status families, where different members of the family might have a different legal status. And so the older children who might have DACA or might be citizens, they acted on behalf of their parents to mitigate risk. The U.S. citizen adult children of immigrants that we interviewed showed great distress and fear that their parents could be taken away, detained, and deported. And for this reason, some of them even relinquished their own aspirations, such as going to college or having a full-time job so that they could drive their parents to work or so that they could run errands for their parents. And I did want to mention that in spite of all of this, the immigrants we interviewed asserted that they were good people and contributing citizens. They would state as proof of this that they participated in the workforce, they contributed to the nation's economy, they paid all of their taxes, and were rearing children who would also contribute to their communities. So it's not just their tax dollars, but it's also our tax dollars that are funding all of these enforcement operations. But more than that, we've seen in recent weeks how enforcement operations don't just affect immigrants, they're affecting all of us. And so, in that regard, these policies do affect the population at large.
Yes. So let's unpack those enforcement practices. So, what harms do you see created by these current enforcement practices, and also public rhetoric?
Sure. Current enforcement practices and the accompanying public rhetoric affects immigrants and their U.S. citizen children's sense of safety and belonging. And I would argue now more than ever, a lot of our sense of safety and belonging, depending on the community in which you live. But things like roads, schools, hospitals, even churches, they're no longer places where immigrants feel safe. And up until last year, those were considered by Department of Homeland Security to be safe spaces where immigration enforcement could not enter, churches, schools, hospitals. But one of the executive orders passed a year ago took away that designation for safe spaces. In our own study, we had immigrants who have lived in, Florida and the United States for over 20, even 30 years, trying to decide if they should leave the state or leave the country altogether because they felt unsafe. They didn't feel like they belonged. In fact, they shared that they felt hunted and persecuted, and I'm using their own words here. Although we had a few participants state that they planned to return to their origin countries, most of them still felt like they had the right to stay here given everything they had contributed to the United States, and also that their children have the right to access US institutions and the opportunities in this country. So nonetheless, these enforcement practices and the public rhetoric deterred immigrants from accessing public services even when they or their children were eligible, such as healthcare services, which is dire for public health. And like I indicated before, some term would turn to home remedies for relief from illness, or if they knew of a trusted clinic, they might seek their services. But overall, institutional avoidance is quite prevalent. That said, the immigrant population and their children need services to be able to carry on, and this will likely place the burdens of providing these services on schools, clinics geared to immigrant populations, and local community-based organizations to mitigate the harm caused by current policies.
Yeah, and like you mentioned before, they participated in the workforce, they contributed to the nation's economy. So it's hard when the decisions that they have to make is just heartbreaking. Um, so the majority of our audience are public health practitioners. So what can public health practitioners do to support immigrant well-being?
Well, to begin, public health practitioners can promote trauma-informed care. This kind of approach recognizes the impact that long-lasting trauma can have and addresses it by providing physical and psychological safety, emphasizing understanding and trust, and ensuring that re-traumatization doesn't occur. Within this approach, practitioners need to know how to recognize the signs of past trauma and build trust through clear communication and understanding of how culture, immigration status, and race can intersect with trauma. This is even more important given the current moment. Institutional policies can also adapt to meet the needs of immigrant populations. For instance, public health practitioners can remove unnecessary ID or documentation barriers in clinical settings. In the study that we conducted, we were so alarmed by the levels of emotional and psychological distress that we came across among our participants that we recruited bilingual therapists who were willing to provide pro bono services to some of our participants. And they agreed to waive certain documentation requirements, easing participants' concerns and making it more likely that they would reach out for help. And then last, public health practitioners can strengthen relationships with trusted community messengers and immigrant serving organizations so that immigrants come to know who and what institutions they can trust. I know that after Florida passed its 2023 bill, many hospital emergency departments created multilingual messaging campaigns that instructed patients that they had the right to refuse to answer the legal status question. Community messaging needs to be well thought out and intentional to reach the right populations. So, with the help of immigrant serving organizations, immigrants might perceive this messaging as more credible than without their assistance.
Mm. Yes, thank you for that. So, really being in the community and building that trust. Uh, yeah.
Exactly.
So, um, what resources or tools do you recommend for people wanting to learn more?
Well, to begin, I think it's important for people to know what's happening currently. So, for concise information on what immigrants and their children are experiencing in the current moment, anyone can read our report that we issued in December based on our summer research, and that can be found at the website that's on the slide. You can find the report in English and in Spanish, and we have one-page summaries in 7 languages. We also have a narrative toolkit for those who are looking to use the report to educate others or to help them disseminate its findings to other audiences. For research on legal status and health, and especially in mixed status families, I highly suggest the work of anthropologist Heidi Castañeda, who has several books on these topics, and they're listed there. For practitioner guides on trauma-informed care, the National Child Traumatic Stress Network, created by Congress in 2000, has some guides that I think could be useful in terms of implementing trauma-informed care with a focus on cultural competency. And just a few words on cultural competency. It's crucial, as one of our own studies uncovered. We were examining the effects of fear of deportation and experiences with racial discrimination on whether immigrants sought care and or if they hesitated to seek those services. And when we controlled for factors such as socioeconomic status, race, gender, and other social factors, racial discrimination was actually more important at that time, and this data was collected in 2023. It was more important than explaining healthcare hesitation than even fear of deportation. So it was those experiences with racial discrimination that people felt that kept them from pursuing further healthcare services. So I can't emphasize enough how important cultural competency and training and unconscious bias are to making healthcare spaces safer for this population.
Yes. Well, thank you, Elizabeth. We will make
Thank
sure that
you.
these resources will be included in our resource guide. We will circle back to you during our Q&A. But for now, I would like to welcome our next guest, Ivy Suriyopas, to continue the conversation. Hello, Ivy. Welcome.
Hey, thank you so much for having me.
Yes. So, could you begin by sharing your role at Grantmakers Concerned with Immigrants and Refugees, also known as GSIR, which I will be calling it from now on, and then offer an example from your work that captures what immigrant and migrant communities are navigating right now. We heard a lot from Elizabeth, but from your perspectives, how are these conditions affecting their safety, their well-being, and a sense of belonging?
Of course. Well, as Soraya shared, I am the Vice President of Programs at GSIR for short. We're a philanthropic intermediary where we seek to organize philanthropy. That basically means we try to bring funders to move their resources and power to the immigrant refugee justice movement through a variety of different programs, webinars that we hold, publications, and so on. We're guided by our values and our principles, including solidarity as highlighted in this webinar, and of course, in the space of philanthropy, abundance, and really approaching from that perspective. We are a membership-based organization with, I think now this slide is outdated, we have 130 plus members around the country and a couple overseas. We have funders across the country, as well as a significant portion in the West Coast, but we also have great representation from the Northeast and other parts of the country. And finally, with respect to the other part of your question about an example of our work, you can see that, immigration we have seen in the headlines for the like the year now, it's really intensified. And what we do is we try and help funders see beyond the headlines and really try and understand what's happening behind, like on the ground level, behind the scenes. And we've seen the targeting and scapegoating of immigrant refugee communities, but just because it has started there doesn't mean it will end there. And as Professor Stephen Levitsky at Harvard has noted, we're no longer at the point of sliding toward authoritarianism. We have already slid. However, it's not irreversible, and there are steps we can take to reestablish our democracy. And so in terms of the kinds of work that we've done, this is an example. This slide shows some of our multi-pronged programming, where last fall we did a 3-part series examining anti-authoritarianism and what funders can really do and understand about the slide away from our democracy. Then we published the lessons and recommendations from those speakers. There were 9 total across that series, plus the funders that helped support or facilitate those conversations. And then finally, we had a strategy session at the end of the fall to really bring together philanthropy to strategize how they can be best partners for nonprofits who have been subjected to investigations. How can they support free speech and those who've been targeted for their organizing or for their dissent? And really trying to explore the number of ways we can support the community-based organizations that are supporting our immigrant refugee communities.
Yeah, so let's go back to one of your values, like the one around solidarity. So how does the solidarity narrative help shift the way we talk about immigrant health?
Well, so solidarity is a very important value for us. And we also try and highlight different values and principles, whatever like really helps funders to align with our thinking. So highlighting other principles that are related, such as the importance of belonging and shared prosperity. I already mentioned the idea of abundance and how a shared future for immigrant and refugee communities is better for all of us. And there are enough resources for everyone involved. And really thinking about solidarity as a house on fire, right? If you have a house on fire, you can't just ignore what's happening because that fire can spread. So how can you show up in solidarity to stop that harm that's happening so it doesn't harm other neighbors and residents in the community?
Yeah, so I'm sure this is easier said than done. So what challenges do institutions face when trying to practice solidarity?
Well, as you can imagine, there are any number of challenges we experience. Philanthropy is a complicated sector, and it tends to be risk averse in general. And during this very difficult year, there are fears of reputational risk or financial risk or legal risk. However, the level of risk that philanthropy and funders experience is nothing compared to the frontline risk that community-based organizations and immigrant refugee communities themselves and U.S. citizen allies are experiencing. And so we really try to move funders towards that solidarity perspective. Other challenges include that scarcity mindset. Of course, we're always trying to transition people to thinking more in terms of abundance. And, you know, like that inability to recognize what's really happening here. This is not a party problem between, you know, one side of the aisle versus another. This is really about our country and the state of our democracy and what we can do to really recognize that this problem is so deep-seated that this is, as I said, going beyond targeting and scapegoating immigrant and refugee communities. With the death of Renee Nicole Good, it's not going to stop there. And really, how can we protect our democracy from the type of authoritarian consolidation that's been happening right now?
Yeah, so let's look at like the health-related impacts. What is GSUR hearing from partners across the states about health-related impacts?
Do you mean your question about philanthropic response? Oh, I'm sorry. I'm skipping ahead a little bit. I apologize. Health-related impacts. Sorry.
Yes.
So, yeah, absolutely. In terms of the health-related impacts, Elizabeth has already shared a number of them, ranging from abduction or fear of abduction and enforced disappearances by the state of members of our community, people in Minneapolis that are being taken from their homes, that are like within 90 minutes being sent to Texas and then like redeployed or transitioned to other places in Texas so that family and loved ones can't find them. That's really affecting the family member and community networks at large in terms of the stress and the loss of the loved ones. We have, the reverberating effects to the food chain that we have, where construction workers and day laborers are who are predominated by immigrant communities, are affecting our access to affordable housing. So this is not just an immigration issue, obviously, if our housing supply is being affected. Our care economy, immigrants are also part of the domestic workers who take care of our children, who prepare our food for those who can afford it, who help take care of our elderly or those with disabilities. That care economy is critical and under-resourced and underpaid. And if those workers are staying home and not coming to take care of those loved ones, that's also going to have health impacts that reverberate throughout the community. And of course, the summer law that got passed or signed on 4th of July, HR 1, the dramatic cuts to our public safety net, access to public benefits, to divert resources to law enforcement, almost tripling the budget for immigration and border enforcement, is really like taking money away from healthcare and safety towards enforcement and scapegoating of communities. And really, by disappearing people from the streets and taking them to detention centers for possible eventual deportation, you're also eliminating a huge tax base and removing a critical revenue for our governments to be able to function. And I would be remiss if I didn't mention the other impacts as well. We've already talked about people fearing leaving their homes, but the constitutional protections that are being ignored right now by immigration enforcement is also leading to the chilling of speech. People are fearing speaking out against this government. Philanthropy is fearing putting out dollars. And that has really affected our ability to call ourselves as a model democracy. And what does that mean for the future of our country if we're not able to live by the values that we try and extol to our children and future generations, but also to other countries overseas?
Yeah, and you just mentioned, the fear of philanthropy. So, how they should respond. How are they responding? Or maybe a better question is, how should they respond? Would you mind going quickly through the recommendations that you have for them?
Yeah, absolutely. Our recommendations are to move flexible funding, no strings attached, multi-year support, really to go beyond the minimum law, which is only 5% of the endowment, really support immigrant communities, build that trust, as Elizabeth emphasized, with the grantee partners, really also, to the extent possible, use the funders' voice and influence because they have the strength and the privilege to be able to withstand the risk. More so than those at the ground and community level. And to the extent possible, fund collaboratively, work with other funders who are like-minded. And then in terms of just immediate action, right, like the criticalness of moving the money now or accelerating the spend down. If funders are already planning to spend down their dollars, move that date up more quickly. it is possible to move dollars in a rapid response way that still has a medium and long-term perspective. We've seen that during the pandemic response. We can do that now. And really, I would emphasize the importance of not complying in advance and not to anticipatorily obey in this moment. There's so much need right now. The federal government is using wartime powers during peacetime to attack and occupy our cities and communities. So that needs a robust movement by philanthropy to support the communities that are being attacked by their very own government.
Yeah, so that's philanthropy. And I know that there's overlap with what public health departments and practitioners can do right now. What are your thoughts about that?
Yeah, I mean, public health departments are such critical partners in this moment. In terms of the advocacy, Elizabeth mentioned I think she called them safety locations or sensitive locations, as the government's memos have indicated. So health facilities, schools, houses of worship, and so on are considered, historically were considered up until last year, safe places where enforcement would not be allowed. And so to the extent that places like Florida or elsewhere are finding other ways to support the communities despite policies that have been passed, or if the state or localities have not yet passed those laws, advocate for policies at your respective institutions to protect the privacy of not just the patients themselves, but the family members as well. Advocacy for enhanced licensure and access for care workers, right? We saw that during the pandemic, that it is possible to expand and make sure that care workers are licensed despite their training having been overseas. So if the people are staying at home or being isolated, how can we be creative in accessing them and supporting them and providing the opportunity for care workers to be able to meet with them under those shifting conditions? And supporting, this supports everyone. This is not just the immigrants who are fearing leaving their homes. There are also immigrants and U.S. citizens alike who have disabilities or are physically isolated. So how can we continue to think creatively to support them? And just recognizing the layers of mental trauma, health and trauma that are happening here. There's not only trauma that's happening to us as a country right now, with what's happening in Minneapolis, what started in Los Angeles, what, rumors have said that this is going to spread to other cities in the coming weeks. But a lot of these immigrants themselves experience trauma in the journey coming to this country or experience trauma in their origin countries. And so there's a lot to unpack there, and how can we be respectful and understand and have that cultural competency to really support their health and road to recovery.
Yeah. You mentioned in the beginning that GSER offers webinars. And I know the next coming slides, we have so many resources that GSER has to offer. Can you walk us through those slides real quickly?
Yeah, absolutely. So I mentioned at the top that we have webinars. This is really to inform our funder network about the latest state of play on a variety of different policies. As Elizabeth shared, there are executive orders coming out on a regular basis. There's also state and local policies. So we try and inform funders on the variety of different changes that are happening there. Beyond that, we also publish information resources where we create, everyone learns differently. So some people might read better as visual learners. So we publish recommendations, we share policy analyses and so on. In addition to that, we also lift up the perspectives of the movement. So we have this blog series where we have interviewed movement partners, so you hear directly from them about what they're seeing on the ground and what their recommendations are. We are a national organization, but we also have a state and local framework where we partner with funders in these orange geographies here to really balance between the traditional immigrant gateways, but also the city and state parts of the country, the regions where there is fast-growing immigrant populations, but also where there is opportunity in those places like Florida, where the government is testing out restrictive policies, how the movements are responding in kind, right? How are they trying to engage in survival during this period? We also, in addition to asking philanthropy to move those dollars, to also use their voice. And so we have a policy agenda where we highlight our values, our position on a variety of different principles, such as protection and safety, well-being, sense of belonging, and really how we can strengthen our multiracial democracy. And we ask funders who can to join us on that journey. And then finally, in terms of our messaging, our info resources, we also have a messaging toolkit where we help funders to make the case within their respective institutions. If they're an education funder or a health funder or a democracy funder, how can they advocate within their institutions to move those dollars? And if they don't already fund immigrant and refugee communities, how they can do that, and how, like, what are the talking points they can use to persuade and move their leadership to support this approach.
Yes. Oh, thank you so much, Ivy. I love those narratives. That was quite comprehensive, and we really appreciate you sharing this. Our audience can reach out to you via LinkedIn, email, and your website. But you'll find a copy of all these slides on our resource page. Before we dive into the Q&A, I also want to share that CHR&R has several resources. Also, What Works for Health has several resources, and we will make sure that we will include those in the resource guide that we send to your inbox before the end of the week. But now I would like to turn it over to Joanne, because I'm sure that there are some questions for our guests.
There
Joanne.
sure are. Thanks, Soraya. I want to welcome both Elizabeth and Ivy back to the space here. And I'm going to start with Elizabeth because this is something I was curious about when I first met you, and so others have been too. I think this is pretty straightforward, but can you explain the slash in the name of your organization and the meaning behind it?
Yeah, of course. Um, it's drawing the distinction between immigrants and migrants. For example, there are groups who are U.S. citizens, but who migrate and not just from one state to another, but from territories, for example, U.S. territories to the mainland U.S. And so we wanted to include those populations in the scope of our research. So Puerto Ricans are one example. So it's to be more inclusive of people with that migrant experience.
Thank you. And this question is for both of you. I think you can both touch on it. There was a lot of data, statistics that you both shared about the immigrant experience. And some folks are wondering, is there a difference in different subgroups of immigrants? So, for example, many of these examples were from Hispanic and Latino experiences. Is there a difference in how, for example, European immigrants have been treated or acting in recent years?
I could start off and pass it to Ivy. In our research, we ended up having representatives from Latin American countries, but also Caribbean countries like Jamaica, Trinidad and Tobago. And I would say that if we wanted to compare the European experience with any non-white immigrant experience, you will see differences. I do know that some European immigrants have been rounded up by ICE, but when you look at the aggregate numbers, this is very much not just an immigration push, it's also a racial enforcement project, because it's been very clear from this administration that the undesirable immigrants are those that are non-white. And all of the research prior to this moment on detention and deportation suggests that non-white groups are disproportionately represented among those who are detained in our camps now that keep expanding and deported.
Yeah,
Ivy?
I'll just add, if I could, a couple other pieces. To add to the detention piece, there have been reports that have come out for years now about the treatment of Black immigrants in particular in detention. They are overrepresented in the arrested deportation pipeline, and they have longer bonds, they have higher bond amounts to be released from detention. So the amount of harm that they're experiencing is even worse as Black immigrants. And then the other piece on white immigrants, the refugee admissions cap was lowered this year, or this past fiscal year, to the lowest in recorded history, even worse than or lower than his first administration. And then the amount of refugees that were admitted, the majority, if not almost the entire refugee admission potential, was allocated to white South Africans. And so that clearly supports what Elizabeth is sharing, that there's a very concerted effort here to support or promote migration of those who are white versus those who are not. And then that's not to mention the fact that those who are being profiled at traffic stops and so on are by and large people of color, Latino face. Specifically in Minneapolis, they're also seeking Somali or hijab wearing people of color, and Hmong members of the community who come from Asia, of course.
I'm so glad we got to that question because you all did a beautiful job of saying why we sort of focused where we did with this. I think for the last question, and we'll have to keep the responses short, is there were great examples about the impact on individuals, families, on community health in schools. Folks are also thinking about other impacts in the community, such as on businesses, maybe on, the job market. Can you both touch quickly on, because those other sectors could also help in this effort in a collective effort to try to really fight against the way enforcement is being handled. But are there other sectors that there's data where there's being negative impacts because of the targeting and the enforcement?
Well, I can mention for businesses, in terms of the response, businesses are certainly being affected. Like entire towns have shut down when enforcement has been visited upon their communities, sometimes in solidarity with their employees and their customers, but also because the employees are not showing up for work. And so a lot of businesses are being trained on what their rights are as employers and how to respond to enforcement, how to stand in solidarity with, again, their employees, their customers, and their communities, by learning how they can also, provide that cover that's so critical during this time.
Thanks.
Yeah, and
And
I'm
go ahead,
sorry.
Elizabeth.
I'll just add really quickly that because so many people aren't going out shopping, immigrant businesses have really taken a hit, uh, closing down because their market is basically in social isolation right now.
Yeah, great points. Well, folks, I'm sorry if we didn't get to your question. Remember, we have more time in the post-webinar discussion group with Elizabeth and Ivy to address more questions and hear from all of you about what's happening in your communities on this topic. But for now, I will turn it back to Soraya. Thanks so much, Elizabeth and Ivy.
Thanks so much, Joanne, for addressing so many questions. I know we only had a short amount of time, but I'm happy to hear that Ivy and Elizabeth will join us for the discussion group. But we would love for you if you take a moment to complete the brief survey that Erin is sharing in the chat. We love hearing from you. How did this topic land? Were the approaches offered useful? We really read each and every comment. And then join us next month with Risa Wilkerson and our own Joanne Lee from Healthy Places by Design to explore how social isolation impacts health and learn practical community level practices to strengthen social connection, equity, and belonging. And like I mentioned, please plan to continue the discussion with us. Join us for a post-webinar discussion led by Joanne Lee, and Erin will drop the link in the chat so you can join. And then I want to thank our guests, Elizabeth and Ivy, again for your openness, your care, your thoughtfulness, everything that you brought in sharing your experiences and knowledge with us. We really appreciate it. And to the audience, thank you so much for joining us today. We really appreciate your time and your engagement. Have a